Tula, she's an older dog. She's been in for 2 recent dentals. She's had anesthesia. She's had a few extractions. She's even had blood work. So yes, I advocate for thoughtful veterinary care. But after nearly 20 years in clinical practice and helping thousands and thousands of pet parents holistically heal their animals at home, there are a number of specific things that I saw recommended that personally I will never do with my own animals. So this is my 2025 version, 7 things I would never do with my own animals involving veterinary care. Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets. Number 1, I will never feed this stuff. Vet approved prescription veterinary diets, conventional dried kibble to my dogs, to my cats, especially when it comes from a vet clinic. In some cases, I personally just think it is the wrong suggestion. Let's take the example of a cat with feline lower urinary tract disease. Why in anybody's name would we recommend, sending your cat home on dry cat kibble? Knowing full well, one of the primary, most important treatments is increasing fluid that's going into your cat, that's then going in and being able to flush the bladder, flush out the inflammatory cells, flush out the crystals. This essentially is moisture depleted. Yet still so many cats are coming in diagnosed with urinary tract disease and they're going home with dry kibble. Or let's take the instance of a dog, maybe he or she's had some blood work, diagnosed with early signs of kidney disease, maybe slightly elevated BUN, slightly elevated creatinine, slightly low urine-specific gravity. Often one of the first things is we got to get your dog on this vet-approved kidney diet. We're going to really restrict the protein. Going to be so much beneficial. Now we know much more of the current research, especially early stages of kidney disease. The most important thing is restricting phosphorus, not protein, and increasing fluid content. If you're just going to be feeding dry kibble, you're not increasing fluid content. If anything, you're decreasing it. And then, as my rant goes on, you can look at the label and you can see, what are the ingredients that are making up the so-called healthy prescription diet? What do you know? It says chicken meal. It says corn. What? You can look at many of the so-called veterinary-approved prescription diets. Those are not things that I would choose to feed to my animal. Based on all the things I just discussed, I would not be feeding the so-called these prescription veterinary-approved diets, except in very select cases. For most of our health concerns affecting our dogs and cats, there are a number of other great options. There's great homemade diets. I've got many of these recipes discussed on YouTube. Some of the health conditions, are animals that are diabetic, especially our cats. You can be looking at a high protein homemade diet. You can be looking at high protein, high quality canned cat food. Especially if you're looking at a single ingredient cat food. And there's a bunch of great companies out there that are non-veterinarian, non-prescription diet. If your cat has been diagnosed with urinary tract disease, getting them on a canned, single ingredient, high protein cat food is so much better than any of these so-called prescription diets. Cassian would not be on the prescription diet, for sure. Number 2, definitely avoiding this stuff. These monthly oral flea, tick, heartworm, kill everything medications, in my opinion, these can be really harmful for our pets. These are insecticides that you're giving to your dog or cat orally, for instance, maybe even topically. Definitely some of that insecticide is making its way into your pet's blood system. It's going to then be metabolized, affecting their organs. You give it to them orally. They've got to ingest it, break it down in the intestinal tract, absorb it, be altered, and perhaps in some state in the liver. At the very least, you're going to have residues of some of that insecticide staying within your animal every single day. Imagine giving this to your dog or cat monthly. So imagine you taking some type of insecticide which affects the nervous system of a critter. Quite possibly it would affect your nervous system. Would you be comfortable taking an oral insecticide for the rest of your life? It makes no sense to be doing the same thing to our dogs and cats. And if we do that, it really does make you wonder, what role do these flea and tick medications then play in our pets' long-term health? Is there a correlation with cancer? In my opinion, there likely is. Get yourself a flea comb. Comb your pets. Daily check them for fleas. Daily check them for ticks. Remove them appropriately. Try something holistic like this. What is it? This is a catnip spray. It's catnip essential oil. It's called nepentolactone in a spray formulation. Nepentolactone is shown to be a pretty effective insect repellent. You've got a cat who goes outside. Cassian isn't. You could just lightly mist him or her. Do that a couple times a week. And the really nice thing about catnip is it is actually safe for cats. Right? So consider the holistic alternatives as well. What do I use in my house? I use this. If there's any, at least once a week, I'm going to be combing Cassian, combing Tula. Anybody's itching, I pull out the flea comb. I start with the simple basics first. Check first. If you can just manually remove the critters, keep them under control, then you can avoid stuff like this, which is so much better for the long-term health of your pet. Number 3, you need to be thinking about avoiding this. Multiple vaccines given year after year after year. Clearly, vaccines, when they're given appropriately, they offer like significant benefits to our pets. But if you're going to give your dog or cat multiple vaccines, and these vaccines are given potentially yearly, then you're repeatedly stimulating the immune system, perhaps for diseases that your dog or cat's never going to be exposed to. And then by doing that, that can cause the immune system to react inappropriately. May trigger things like an overactive immune system, a dog that is itching and scratching that has allergies. It may cause your dog or cat's immune system to react inappropriately, causing something like autoimmune disease. We know with our cats, for instance, a high incidence of kidney disease. One of the big thoughts or concerns is this repeated use of vaccines has then caused the production of these autoantibodies, which have attacked the kidneys, leading to kidney disease. If you have an indoor cat like I have, Cassian, my opinion, he doesn't need any vaccines. He's not going to get exposed to FVRCP. He's not going to get exposed to rabies because he's not outside. Never mind the fact that I live in an area where there's a very, very virtually non-existent level of rabies. If Tula were a puppy, I would give her puppy boosters. Distemper parvo at 8 weeks, distemper parvo at 12 weeks. Likely then do a booster of the rabies vaccine at 6 months. And probably that was it. And about a year after that, I would do some titer testing just to see if she had adequate level of antibodies, so adequate level of protection. But probably that's all I would give her for vaccines. Tula, she's 14. She has not had a vaccine in probably 6 or 7 years. She's doing great, right? So the point being, the vaccines are there to protect against serious infectious disease, which are much more common when your dog or your cat when they're young. But after about a year of age, the chances of getting those serious infectious diseases, it's far less. And then in many cases, your dog or cat, say they had their rabies vaccine at 6 months to a year, that rabies vaccine may confer protection for upwards minimum 5, maybe even 10 years. The simple long-winded conclusion, less vaccines, less often, way healthier animal. Number 4, the so-called routine preventive diagnostic tests. The summary, I don't advocate for those. In fact, I will not be doing those with my own animals. Do I think 2-year-old healthy Cassian needs to rush off to the veterinarian every 6 months to a year to have a whole array of different blood tests? When clinically he's eating fine, he's drinking fine, his weight is staying the same, there is no other clinical change? No, I don't. And in fact, there are certain errors and artifacts that can come up on blood tests, which then cause your veterinarian to say, oh, maybe there's something wrong here with the liver. We've got to explore this a little bit further. We've got to do additional tests. I think I maybe want to ultrasound the liver. What do you think? It's only going to be another couple thousand. My point being here, when you have a healthy dog or cat, which has no clinical signs, they're looking great, it's very, very unlikely that any of those diagnostic tests are going to come up abnormal because your animal is normal, right? When in fact, there is no real case for that happening. This is not something that I was taught in veterinary school, but they didn't talk about preventive wellness diagnostic tests. They talked about looking at the dog or cat, doing a thorough physical exam, taking in a really thorough history, and then looking at the clinical signs. So if you saw a clinical need to do a test, then you would. There was no discussion about these so-called preventive diagnostic tests, these wellness tests, because they know that 99% of these are going to be normal. But if you have an older animal, one who's considered senior, who's going in for a fairly big surgical procedure, Tula was in for a dental, she had some extractions, then that makes sense to do the blood test. Tula had blood work prior to having a dental about a year ago, and her blood work showed an elevated liver enzyme, which I wouldn't have known about. I had some concerns about how she was, her appetite a little bit lower, so I kind of wondered. So in part, I was encouraging them to go ahead and do the blood work. We saw that she had elevated liver enzymes, so I knew there's something going on with her liver. I took her off a type of specific liver treat, which I think was damaging her liver. I then put her on our liver supplement. It's been about a year. Her liver enzyme has come markedly down, getting near the normal range, which has been great. And I wouldn't have known that without the blood work. So what I'm saying is clearly there is a place for diagnostics, and I did tons of diagnostic while I was a practicing veterinarian. But thoughtful ones and ones that are appropriate. But this, 6-month-old animal is having, these wellness blood tests, it makes no sense to me. Number 5, I advocate for a combination of holistic or natural care as well as conventional veterinary care. So for instance, say Cassian was an outside cat. He was in a big fight. He had this big gash or an open wound. I'm not just going to clip it and apply honey and hope for the best, right? If I looked at it and decided, yeah, that's something where he could really benefit from surgery, having him sedated, put on anesthesia, cleaned properly, having it closed up with sutures, and then clearly that makes sense. You're not going to just, no conventional, all natural. But for many, many instances, just because your dog or cat has a little puncture does not mean that he or she needs to be on, this high-powered antibiotic. It's quite possible if Cassian just had a couple of puncture wounds, it would be a matter of clipping and cleaning them using some type of topical antiseptic, and then starting them on something like a holistic alternative, something like this, propolis, which is very well tolerated by our dogs and cats, and really is a surprisingly effective natural antibacterial. Or perhaps Tula's hurt herself. She jumped off of something she shouldn't have. She's in serious acute pain. Yes, I would probably try some type of natural product first, probably CBD, cannabidiol. But if that was not helping her, then I would be trying some of the conventional veterinary treatments. A stronger narcotic like hydromorphone. Maybe an NSAID if she needed to. Definitely short term, not long term. But I would use it to give her pain relief. So what I'm trying to do is give you a bit of a context where it's not just all or nothing. It's not all alternative. It's not all conventional. You can combine both. And that's sort of my style of thinking and I think my style of teaching. And I encourage you to think that way. We're taking the best. If you're still seeing your veterinarian, you're getting some conventional veterinary care, but you're also, you're using so many of these holistic products that I'm discussing and sharing. Because that is the exact same way I'm treating my own dog or cat. Number 6, I don't blindly follow everything a veterinarian says, and I suggest you do the same thing. Your cat goes in for an exam, perhaps the veterinarian listens to his lungs and he says, maybe there's a slight wheeze. I think we should do a workup x-ray, maybe we do some lung function tests. It's you as your cat's advocate, your pet's advocate, to ask and question the veterinarian. To be like, well, why are we doing these tests? What do you expect my pet has? And if you do these tests, what are you going to get out of them? If you don't do these tests, what are other options? Go down the thinking process and ask them specific direct questions. If they suggest a medication, I think your dog should be on this, he's a little bit limping and needs to go on some gabapentin. First, you can ask why this choice of medication? What are the potential side effects? Is there another alternative? Is there a holistic alternative that potentially could provide the same result without some of these side effects? Yeah, sure, your dog's in pain. He could go on an NSAID. It's going to work pretty well, right? All of a sudden, he's not limping. But there is the risk of kidney disease, the risk of liver disease, the risk of vomiting, diarrhea, intestinal ulcers, etc. Is there an alternative? Maybe you want to think about this. The cannabidiol. Yeah, it's an anti-inflammatory, also provides pain relief. But we don't need to worry about kidney disease, liver disease, stomach ulcers, etc. My point being is that you are being an active, thoughtful, engaged pet parent. Any progressive veterinarian is going to welcome some of the input, you asking the questions, advocating for your dog or cat. Then number 7, it's you taking an active role in your dog or cat's healthcare. And so much of that is being taught on our channel. Number 1, how to do a basic at-home pet health exam where you are briefly examining your dog or cat once a week. You're going to weigh them. You're going to know what their normal temperature is, their pulse, their respiration. You know how to look into their eyes, right? Look into their mouth, look for signs of dental disease, palpate their lymph nodes, feel their limbs, palpate their chest, palpate their abdomen, feel where their urinary bladder is, right? Feel where those lymph nodes are behind their knee, called the popliteal lymph nodes. Extend their hips, right? You can do a basic pet health exam, and you can do that in your dog or cat. You can get a real good sense of then what normal is. So if there's something going on, like where it appears abnormal, you can actually, have a better idea of exactly what body system is affected, and then know the more appropriate point of care, like how to potentially if there's a diagnostic test, what diagnostic test should happen, and number 2, what potential alternative treatment could be used. If your dog has a wound, for instance, your dog has a hot spot, you'd be able to know how to care for that at home, right? Where you can give your dog some type of sedation if you need to, maybe some CBD, make it a little less painful. You can clip it, you can clean it, use a topical antiseptic, something like Hibitane, which you can pick up in any pharmacy, and then treat it topically, for instance, using our teen aspirin remedy. But those are all things that you can do at home without going to see your veterinarian, which essentially is what they're going to be doing there, but you're using alternative products. And trust me, after being at the vet, you're going to save a pile of money. Say your dog or cat has been sick, they've not been eating, not been drinking very much. One of the best treatments is being able to rehydrate them, give them other electrolytes, which make a big difference. And often in veterinary practice, it's like one of the few things we did. So you can learn how to do subcutaneous fluids, where you get an IV fluid bag. This is lactated ringers. You get a drip set to get through your veterinarian, a needle that goes on top. You're going to hang your bag up somewhere so it's going to drip in appropriately. You would then take your 20 or 18 gauge needle, pop it just under the skin between your cat's shoulder blades or your dog's shoulder blades, giving your cat somewhere between 40 to 50 mils. I understand I'm a former veterinarian, so obviously I'm going to have certain skills you're not going to have. But the stuff that I share on the channel are something which I think everyone who's watching but can then apply with their own animals. Like, these are skills that you can learn. You can choose to be, a pet advocate. Like, you can choose to question your veterinarian. You can choose to ask about alternatives. You can choose, not to give your dog or cat, that prescription veterinary diet, multiple vaccines, right? All the conventional medication that someone is suggesting they give. And you can ask, like, is there an alternative? And use some of those alternatives. No, you are obviously still seeing your veterinarian. Yeah, and I'm a big advocate, obviously, for seeing vets. I mean, Tula's a great example. Like, her going in, having a dental, having blood work, show that she had underlying liver disease, then I was able to treat it appropriately. No, I didn't go down the path of additional diagnostics, which was discussed. I think we should work this up further. Follow up blood tests. Let's do an ultrasound. Let's look for a liver tumor. She's like, no, clinically, she didn't have those signs. I was pretty confident that there was something else causing her liver problem. And I was really happy to use an alternative product, just happened to be our liver supportive supplements, a milk, thistle, and SAMI to treat her, which she responded to. And I really believe that if you follow those 7 steps, 7 things I'm not going to do with my own animals, you take that same path for your own dog or cat, you're going to have a healthier, longer lived pet. Thanks so much for watching this edition of Veterinary Secrets of the 7 things I'll no longer do with my own dog or cat. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.